Hi, this is Dr. Neal Schwartz. I get many questions about the use of oral antibiotics in the treatment of acne. In this video, let's talk about oral antibiotics, why doctors are prescribing them to you, and how it is that the acne practice doesn't need them, but also does not demonize them. The reason your doctor is giving you oral antibiotics is to try to rapidly bring down the inflammation that is in your skin, on your face or your body. The goal is to minimize inflammation fast because inflammation can cause scarring. Typical antibiotics that are used for acne are of the tetracycline family. That's tetracycline, doxycycline, minocycline. There are also many other families of antibiotics that have been used successfully with acne. The method of action in which these antibiotics are working on your acne is somewhat debatable. There is an antimicrobial action, an antibiotic action, but there's also an anti-inflammatory action. What clinicians have found is that many antibiotics are also anti-inflammatory and used for many other inflammatory conditions that aren't necessarily proven to be infectious type diseases. So, in the case of acne, there is proven to be a bacteria that is propagating the acne inflammation. However, it has also been shown that these antibiotics bring down inflammation in general. So, the remedying effects of antibiotics for acne is twofold. One, it's antimicrobial or antibiotic, and two, it's anti-inflammatory. Now, you notice I used the word remedy before, and that's because that's what oral antibiotic therapy is. It is a remedy. Some people choose to use this remedy long term, sometimes years at a time. Others plan on using it for several months, getting the inflammation down, and then weaning off it and trying to maintain with either a topical program or just with a lifestyle program. That is the goal of therapy for oral antibiotics. Oral antibiotics are obviously not a cure for anything, and as you know from other videos, there's no cure for chronic inflammatory conditions anyway. These are all remedies. The question is, do you want to take an oral antibiotic as your remedy for the long term? And that's where patients get stuck. They're offered antibiotics, and some of them refuse because of the concern of having to use them for a lifetime or even for several years. And that idea doesn't sit well with them. Possible yeast infections, possible stomach upset, possible diarrhea, whatever the concern is, maybe they're concerned about sun exposure, whatever the concern is, the idea of taking a medication, a real medication, every single day for years doesn't sit well with them. So oftentimes, patients will refuse them outright. Now, here's my viewpoint on oral antibiotics. While I don't need them in the acne practice, and I made the videos in the video gallery without them, I also don't demonize them. I see them as a way of bringing inflammation down fast, and anything that brings inflammation down fast will prevent scarring. So in that respect, I have nothing against them. The only thing that I offer to patients beyond oral antibiotics is the question, how are you going to get off these oral antibiotics and maintain control of your skin if they work? Of course I say if they work because many people take oral antibiotics and they don't work at all, not even as a temporary remedy. However, let's assume they do work. The question remains, how are you going to get off these oral antibiotics if you still are very acne prone and your skin is not in control otherwise? That's the question that creates problems. In the acne practice, we take control of the skin beyond the need for any oral remedy. We do use topical remedies, but they are the type without side effects. So if you have them adjusted properly, you can use them for as long as you need without having any consequences of them. One of the frequently asked questions I receive by email is this, quote, Dr. Neal, I just ordered your kit. Should I stop my oral antibiotics that my doctor has me on? End quote. My answer to this question is this. If you're already on oral antibiotics coming into the program, I recommend, if it's okay with your doctor and it's okay with you, you stay on your medications for the first part of the program while we're taking control of your skin. Then, after your skin is in total control, you can contact me and ask me how to wean off them properly forever. That's one of the goals of Acne Bootcamp, is to wean people off their oral medications that they've been on for a long time, whether that be the birth control pill, spironolactone, or oral antibiotics, many people come to me with a specific question: can you help me wean off these pills and still maintain my skin? The answer is, of course. That's what we're doing here. We're taking control of the skin without oral medications. It's always possible, and I've captured these results in high definition to show what is possible. So, a quick recap. Oral antibiotics are not to be demonized, and they also are not needed in the treatment of acne. They can speed up the healing process, but there are many ways to speed up the healing process, so this is not a necessary medication. If anyone has any differing opinions regarding oral antibiotics, Accutane, or any of the videos that I'm making here, I recommend you and your doctor review the video gallery to see the extended body of evidence that has shown that acne is treatable without oral medications. I myself am not against oral medications, but what I am against is the hopelessness for those who have failed oral medications and now believe that they have exhausted all options and they have tried everything. That hopeless situation I find unacceptable. That is why the subheader to the acne practice is clear skin without oral medications. It's not to say that oral medications are bad per se. What it's saying is hopelessness after failure of oral medications is unacceptable. And that's my stance on acne, and I've gone to great lengths to prove this viewpoint.